Okay, so we are C7 Asia A pressure relief, and we're going to talk to you about different ways to do that pressure relief. But before we get started, does everyone remember kind of the rule of thumb for how frequently you should be doing pressure relief while you're in your wheelchair? What's that?
15 minutes.
50 minutes or 30 minutes. It's kind of that 1 second to 1 minute ratio. So 30 seconds every 30 minutes, 60 seconds every minute. That sort of thing would be good. So we're going to have Alyssa have a seat here and be our patient. And we're going to kind of walk through ways we can do this. As you notice, we've set her up with a mirror here. So for the first time that we're teaching this, we're going to use that kind of external focus of attention because we want to make sure that she is fully clearing her ITs off her chair. So this is going to be a good way for her to use her kind of visual system to see what's going on. So hopefully over time she can kind of get proprioceptive sense of kind of where her body needs to be in order to clear her ITs. Another thing to kind of keep in mind when we're doing this is safety, which is always very important. So making sure that wheelchair is locked, the caster wheels are forward, and then we're going to kind of go from there. All right, so the first one that we are going to teach is the lateral lean. And again, for kind of a new patient doing pressure relief, one of the ways to recommend to do this is to have an external support surface that they can kind of lean onto to make it a little bit easier task for them to do. And then they'll eventually be able to progress from not having to use that. What we're going to have Alyssa do is she's going to hook her right arm on here, because we're going to clear her right IT. Again, she's C7, as we've heard multiple times today, about which muscles we have and do not have, and the importance of maintaining a tenodiscus grip. So we won't talk about that too much other than to remember the importance of that. And then we're going to, you're going to watch yourself in the mirror. And what I want you to do is to see if you can, using your triceps here, kind of extend and kind of lean over onto the table here and see if you can trunk lean here. So again, as a new patient, she would have not have good trunk control, so I would be being supportive of her to make sure that she's in control here in the safe position. And then you can kind of progress it. Like I said before, she wouldn't need the table, she can kind of lean over. But again, just reinforcing the safety of making sure the caster wheels are stable, everything's locked. She's good. Again, as a new, and you can sit back up here, as a new person, as you're teaching this to them, it may be important to have other kind of extrinsic factors, like maybe setting an alarm to remind them to do their pressure relief. Maybe even having like a sticky or post-it on the actual wheelchair. You know, I've seen things with wristbands that people wear just to kind of remind themselves of, the frequency that they should be doing their pressure relief. Until it becomes second nature to them, they know, that it's time to do that pressure relief.
Okay, and then for progressing it, we thought about removing the mirror because they're not going to walk or wheel around with the mirror with them all the time. And the real reason we thought of that, we just kind of made that up, is because we were talking about, well, how do they know if they're clearing the IT band, or not the IT band, the IT. Because even when we were practicing, we were having a hard time. We're like, wait, when we're doing this, is our IT actually up? So we thought of if the therapist could feel under and say, you know what, your IT is up, this is what your trunk should look like, this is where your head and space should be to clear your IT band, and then and then they'll kind of get a sense of where their head needs to be in space in order for that to happen. So yeah, we would remove the mirror. We also would move from a closed to an open environment because pressure relief is going to become an integral part of their life. It just needs to be a routine. They just need to get used to doing it. So like Peter mentioned with the sticky or with the alarm clock, just to remind themselves that this is something that they need to do every hour. And then something we didn't mention when they're on a non-compliant surface, so like on a couch or in the car, they need to do this every 15 minutes. So that's something that you really need to hone in on, because when they get out of the hospital and they go home, they're going to be a lot more comfortable. They're going to be out of this environment that they've been practicing in, so it's really important to remind them, because this is something that can be prevented, and really they shouldn't be getting pressure ulcers, and it can lead to a lot worse complications. So the other one that we're going to do is the tricep push-up. And this is one because he's C7, so he has his triceps. This one requires a lot more pressure on the shoulders, so maybe shouldn't be done as often as the other two. And it's really important that your patient is strong enough to be able to perform this maneuver. So maintaining their Tino DC grasp, they're going to go ahead and put their hands right up on there, and they're just going to go ahead and pull up, and they need to hold that for 30 seconds to 1 minute. So if you think about it, that's a really long time to hold it. He's shaking a little. So that's a really long time for them to hold a position like that. So that's why the other two techniques are more recommended.
And one way you can make that easier is also kind of getting that forward trunk lean, so you have kind of a less distance you have to go in order to clear the ITs. So that's another way that you can kind of make that task easier.
And if you're introducing them to the forward trunk lean, I would also suggest really, really close guarding, because they are moving a little bit out of their base of support when they're doing that. And then the next one that they're going to do is the walk down. So this is going to get both of the ITs at once. So he's going to go ahead and remove his foot plates. And I think Peter mentioned this, but especially for this one, you really want to make sure that the casters are facing forward and not to the side, because it is a lot easier for them to flip over. So if he's doing it for the first time, I want to make sure that I'm right in front of him. And he's going to use his triceps and his biceps to go ahead and walk down. And then as a therapist, what you can do is you can palpate back here, and actually both his ITs are off of the wheelchair, so he needs to hold that for 30 seconds to 1 minute. And then he can walk his hands back up, still maintaining the Tino de Sus grasp. And then go ahead and put the foot plates back in, which is difficult, like Leanne mentioned.
Okay, so just to kind of reinforce the advantages and disadvantages of each of those three techniques, can someone tell me why you may not want to do a tricep press up as a pressure relief technique?
It's hard.
It's hard, yeah. So for a new patient who may or may not have good tricep strength as their prior level of functioning, it's hard and also puts a lot of stress on their shoulders. How about that forward movement, forward walk down?
You have your base of support, so you can fall.
Yeah, especially for a new a person with a newer injury, they might not be comfortable with that just yet, because they don't have good stability in understanding their proprioception related to tongue control, and that could be a little scary for them, and they may be, a little fearful of falling out. And then for the lateral lean, what's one way to make that an easier task for them to do, at least initially? Yeah, have something next to them. So it could be a table, it could be pretty much anything that is a solid support that can help them do. And then another way you can make it, I guess, to help with the initial learning. What was one of the kind of things that we were using as a external focus? The mirror, yeah. So it doesn't have to be the giant wall mirror, it could just be a smaller mirror. But that's just to, as we said, kind of bridge that gap as they're learning to move from like a visual intrinsic understanding to more appropriate receptive sense.
And then something else that I found, I just wanted to add that I thought was interesting, was they talked about the social stigma of doing pressure relief. When you're out, like imagine if you're out in a restaurant and then suddenly you have to lean forward. So this was at Shepherd Rehab, and they mentioned a technique of crossing your legs in the wheelchair to relieve pressure from like that IT band and then leaning over to the side. So I just thought that was interesting, because I never thought about doing that. I've only learned the other three. So.
Anybody have any other questions, thoughts, comments, concerns, criticisms?
Let's write the criticism.
Nice job.